Hi, welcome to Mad Medicine with Miss P. My little controller there works when it wants to, so surprise. Okay, so today we're going to talk about diuretics, and I know we kind of threw some antidysrhythmics in between all of our antihypertensives, but they correlate a bit to where you can at least understand how they work together for your cardiovascular system. So when we talk about diuretics today, I'm going to try not to make this too long of a video because apparently it has come to my attention that certain people don't have an attention span longer than 5 minutes. So if you don't have an attention span longer than 5 minutes, just don't watch. You can even unsubscribe so I don't have to deal with all of the other stuff that goes along with watching my videos. At any rate, today we're going to talk about your antihypertensives, in this case, your diuretics. So when we talk about diuretics, and I kind of have an issue with this entirely when they're used as antihypertensives, because that's not where the problem is. I'll never fully understand why anybody would use a diuretic as an antihypertensive, because that's kind of to me, that's sweeping a big problem under a rug and then getting a larger rug. So you're like, oh gosh, that's a really big problem. I'll tell you what, I'm going to run to the store and buy a much larger rug to hide this problem under. So clearly, I don't see it any other way. And if there is another way, please let me know and open up a whole new world to me in this situation, because I really don't understand how putting somebody on an hypertensive using a diuretic is solving the problem. Clearly there's a renal issue at that point. There would be no other reason to use a diuretic if the problem weren't already the kidneys. I could see to an extent how there is certain issues where getting rid of additional fluid isn't entirely a kidney issue, and we'll get into that down the line. But on average, when you're getting rid of excess fluid, that means the kidneys aren't doing it on their own. So maybe there is like a capillary issue. Maybe there is a distal onconic Starling's law pressure issue where it is more of a fluid retention due to vasodinsufficiency. I guess, that I could understand. But in general, like when somebody comes in with, and this is going to lead into the CHF talk, because my brain is just never going to accept what people on average think, that like, oh, my grandmother has CHF, so her heart isn't pumping correctly, so, her feet fill up with fluid. That doesn't make sense to me. Like I don't understand that. That's never gonna jive. I don't understand why you think if your heart isn't pumping correctly, fluid fills your feet. So are you dehydrated from the waist up? If your heart isn't pumping correctly, that means that, there's certain organs or tissues that aren't perfusing correctly, yet you're awake, alert, and oriented and talking and eating, probably Kentucky Fried Chicken. So what would make fluid fill in your feet if your kidneys weren't the problem? Because like I've said 100 times before, when you come to the emergency room with CHF exacerbation, we don't hurry up and give you IV DIG. We don't give you a big bolus of amiodarone or cardizem or anything for your heart. We give you Lasix. You get IV Lasix because your kidneys aren't working correctly. And to get rid of that excess fluid quickly so you can breathe with your massive pleural effusion or your gigantic pitting edema, your 4+, your brawny edema, right? We give you a medication that tells your kidneys how to work correctly because they're not working correctly now. That's why if you have congestive heart failure, not just regular heart failure, you can have heart failure where the electrical rhythm or the damage to the myocardium isn't working correctly. Either way, electrical or muscle isn't working correctly to where you have heart failure and not directly affecting your kidneys or your blood pressure in such a way that, you're causing kidney damage and you have all this excess fluid. That's a completely different story. I have seen heart failure. Of course, it eventually leads to congestive heart failure. But when you have straight up congestive heart failure with all the things that go with it, on and off uncontrolled hypertension, pitting edema, that constant pitting edema where your BNP kind of lives at 180, not 8,000, but lives at 180. Now, when you come in with congestive heart failure, acute on chronic, or what we used to call CHF exacerbation, but now it's like an acute on chronic CHF. When you get to us and we see all this massive fluid overload and your BNP is 8,000 and your echo's looking rough and you have like a borderline pericardial effusion, you've got bilateral pleural effusions, you're filled with fluid, your blood pressure's up, we give you IV Lasix because you're in fluid overload, because your kidneys aren't functioning correctly. Chances are your GFR is already, in the 20s or 30s. That's kind of what happens. Whether your BUN and creatinine are okay or not, when they're filled with fluid, when we draw that BUN and creatinine out of a massive amount of fluid, it may or may not look abnormal. But you clearly have kidney damage because this is how these medications work. And we're going to talk about 3 of them. Well, technically 4 of them. Lasix and Bumix are so similar. I'm assuming Bumix is probably like a hair more, I don't know, like undiluted. It's a hair stronger because the doses are a little bit different. Like, you'll see 2 or 4 milligrams of Bumix, if I'm remembering correctly, and I may not because I don't see it very often, where you'll see, 40 and 80 of Lasix IV. So Lasix is real simple, and I should have written it out, but someone even kind of gave me an idea how to remember how Lasix works, right? So if you write like a capital L and then inside write that it works, at the loop of Henle, and it lasts about 6 hours. That's why we generally give it every 6 hours in an acute situation. Lasix, it works in the loop of Henle and lasts 6 hours. So the way it works is it inhibits reabsorption of sodium and chloride at the loop of Henle. So when the fluid is coming through to be kind of filtered through the kidneys, Lasix is there. And I know this is my lame little scenario I came up with 10 years ago or so. Lasix is kind of like the mean bouncer that sits at the loop of Henle, the door to the nightclub, where all the hot little electrolytes are hanging out with some water, and, little sodium and chloride have their little mini skirts on and their low cut tube tops, whatever. And Lasix is at the door, kind of allowing people back into the bloodstream versus the bladder. And he's like, yeah, sodium chloride, you're looking pretty hot, but guess what? You're not coming back into the bloodstream. You need to head on down to the bladder. And where you go, all of the H2O will follow you, right? All the little hot guys in their little toupees, let's say your H2Os, are going to follow you. There's no hot guy in a toupee. They're going to follow you out to the bladder where you will be excreted into said atmosphere, aka toilet, right? So you're not being allowed to come back into the cardiovascular system, the vasculature. So when Lasix does not allow the reabsorption of sodium and chloride back into the bloodstream, everything else is excreted, right? So those fluids are leaving because they're following all of the electrolytes. Now, I know that the book says that it doesn't allow the reabsorption of sodium and chloride, and yet we know that it's a potassium wasting diuretic because potassium is best friends with sodium. It's also best friends with glucose, and we'll get to that later. But when you see that the potassium is following the sodium and chloride out to the bladder, all of the fluid goes with it. So you get rid of your electrolytes, you get rid of your fluid, and then remember in your vasculature, where your vasculature's goal in life is to be isotonic, all of those particles need to match that fluid. So when you lose your particles, you lose your fluid. You lose your particles, you lose your fluid. And it almost kind of seems like you almost lose a little bit more fluid, kind of like at some point Lasix is like, oh shoot, I should have held on to some of that H2O, oopsies. And we only know that because you'll find that once you get rid of those particles and you get rid of that fluid, we know that the fluid tends to drop just a hair more because that's how the vasculature at the capillary level pulls fluid in from those areas, whether you have ascites, a pleural effusion, a pericardial effusion, edema, whatever it is, at that capillary level is where that fluid is drawn back in. That's how you get your fluid in your feet to leave, by telling your kidneys what to do, right? So this is not a capillary pill. The Lasix doesn't go down to the capillaries and say, hey, this is what I need you to do. That's how we know it's not a vascular problem with CHF. That's how we know it's not a cardiac problem when you're in CHF exacerbation with fluid overload, because we give the pill to your kidneys. We tell the kidneys what to do. You swallow the pill, that information gets to the kidneys and says, I need you to stop the reabsorption of sodium and chloride at the loop of Henle, sending everything to the bladder. The fluid follows. Then you've got that drop in particles, that drop in fluid. And because that fluid just tends to drop a little bit more, the vasculature is like, ooh, whoopsies, it's a little sticky in here. Does it feel sticky in here? Kind of feels like a little dry. I think we may have gotten rid of a little too much fluid. Where do we have some excess fluid? And the feet are like, oh, I've got some fluid down here. Or the pleural cavity is like, I've got some fluid in here. Or the pleural effusion, or the pericardial effusion. Or if you've got swelling on the brain in your cerebral cavity, or in your abdominal cavity with ascites. Either way, that's where that fluid is drawn back into the vasculature to balance out, right? So just like we do with our portal hypertension, our cirrhosis patients with this massive ascites, we give 25% albumin, in a bag. We hang that up. That works kind of as a colloid, building up the pressure in the bloodstream, and osmotic pressure, not like hypertension pressure, but the osmotic pressure. So then the vasculature is like, oh crap, there's this massive amount of particles, which is not just going to be excreted through the kidneys like it would with electrolytes. This is more of a colloid, a particle that isn't going to just transfer through that semi-permeable membrane. It's going to stay in the vasculature. So then we hang the albumin. All that fluid is pulled through that capillary membrane into the vasculature from the abdominal cavity with ascites, and then we give Lasix. And we get rid of all of that fluid and those electrolytes. And then a little while later, we hang albumin again, pull that fluid in from the abdominal cavity, we give Lasix, and we get rid of it. So all these medications basically do is like manipulate your body to do what it already is supposed to do, or inhibit it from doing what it wants to do. That's how these medications work. And it's going to do too much or not enough. Those are your nursing considerations, and those are your side effects or adverse reactions when it doesn't do exactly the way we want it to, and you can't necessarily make it do it, right? So just like when you have this elderly person on a stool softener forever, or even a laxative, and they end up having major dehydration. Well, yeah, you caused that. That's how that pill worked. You just did it too much because we're not monitoring their fluid intake. So same thing with Lasix. It works for 6 hours. It inhibits the reabsorption of sodium and chloride at the loop of Henle, sending all of those particles into the bladder. Water's going to follow it. You balance out. That fluid tends to drop a little bit more. The vasculature's golden life is to be isotonic, so it's going to draw fluid back in from those areas to be isotonic. And then what do we do again 6 hours later? Give another Lasix. Spironolactone and hydrochlorothiazide kind of work similarly. So spironolactone is a little different. I kind of wrote it down because you don't see it as often. It's our potassium-sparing diuretic. It causes retention of potassium and phosphate, but it kind of does the same thing. At the receptor sites in the loop of Henle, it's in the distal loop of Henle, it causes excretion of sodium chloride and fluid. So same difference. And what it says basically is that it competes with aldosterone at the receptor sites in the distal loop of Henle. It is still excreting sodium and chloride, only in this case, it causes retention of potassium because of the way it works, kind of like an aldosterone effect. So not necessarily like Lasix, but same difference is it's getting rid of those particles, in which case fluid will follow. So you'll see that spironolactone, that potassium sparing diuretic. So you really kind of have to watch the potassium, and you have to watch the potassium with either. We know how tricky it is with potassium, and we're going to get into that also. I'm just going to make a little note here, because when we talk about potassium, I'm going to kind of do a whole video on that. When it's too high, what you do, and when it's too low, what you do, and how you can fix that, because you just have that very narrow window, and it's so vital to the heart. So spironolactone kind of works the same way, and you'll see that it's like 25, 50 milligrams, I think maybe 100. I can't really remember. You're not going to see it too often, but it's the same difference. By getting rid of excess fluid in your bloodstream, the goal is to kind of, let's say drop or decrease your blood pressure, kind of keep it calm and quiet. but why aren't your kidneys doing that anyway? So clearly we already know that there is some, baseline kidney issue to an extent. And there are also other metabolic reasons to be on spironolactone. So, we're not going to get deep into that. We're keeping this simple. This is, kind of LPN. Not that RNs, may not benefit from some of this, but, I kind of keep this a little basic to not get too deep into it. And there's a whole lot that I don't know about it either. I'm not even going to pretend to be the whole endocrine system. I can't. I think I could better understand quantum physics. There's so much going on, all these little vessels or glands spitting out all kinds of crap in your bloodstream, causing all kinds of other issues. I'm not your endocrine girl. I know diabetes and a touch of thyroid. That's about the extent of my endocrine, and that's all I'm going to pretend to know. Hydrochlorothiazide, same thing. It increases excretion of water, sodium, and potassium at the loop of Henle, and chloride at the loop of Henle. It's just not as powerful as Lasix. It's not going down there like the pushy Foreman that Lasix is, or the hip little bouncer that Lasix is. Hydrochlorothiazide is more like, excuse me, I can't let you back into the club. I'm going to need you to go to the bladder, please. As to where Lasix is like, Vin Diesel standing at the doorway saying, you're not coming in. It's that simple. It's just not. So when you see somebody taking, 60 or 80 of Lasix once or twice a day, you already know they have a kidney problem. That's all there is to it. And I know there's certain people that are never going to understand or want to argue, but if you take a pill to tell your kidneys how to work correctly, then they're not working correctly. If you're an antidysrhythmic, then the electrical portion of your heart and some of the muscle fibers aren't working correctly. That's the problem. And I have tons of patients every day. Very rarely will I have a patient admit they're in chronic kidney disease stage 3 when they're on 80 of Lasix. Well, I take 80 in the morning and 60 at night. Okay, you're stage 3. Oh no, the doctor says my kidneys are fine. Okay, he's lying to you, because if I licked an 80 milligram Lasix pill, I would urinate right here and now. Like, I'd have to go change my clothes. There's no way you're taking 80 in the morning and 60 at night and you aren't chronic kidney disease stage 3. And they're like, oh, my BUN and creatinine are fine. Okay, your GFR is 19. You don't have to believe me, but let's go draw some labs and I'll point it out to you. And I only know this because I've looked through it 100 times. Anytime somebody's on Lasix and we look in the H&P and there's no history of chronic kidney disease, there's no mention of it, the doctor hasn't said a word, BUN and creatinine may be normal or borderline-ish, GFR 34. I'm like, there you go. And I'm showing this student, I'm like, there you go. You have to know that that's the situation. Why else would you be on a pill for an organ if it's working correctly? It's the same difference when, I told you this before, when a patient says, oh, no, I don't have high blood pressure, I take a pill for that. Right, but what would happen without that pill? Yeah, so there you go. Now, there are patients out there that say, well, I take 20 of Lasix like when my feet swell. That's not how that works. You have kidney damage. There's no other reason for your feet to swell. Like during pregnancy, your feet swell, right? Because your kidneys are working hardcore overdrive. What's the main organ that fails during pregnancy that causes all kinds of issues and toxemia and everything else? Right. So it's already under such immense stress. It doesn't mean that you can't get back to baseline and normal to an extent, depends how much damage, but we all know the percentage of damage of your kidneys before you even start to show signs and symptoms is like, what, 70 to 90%? That's not even a heads up. Like, come on, Jesus, for the love of Pete. Father God, give me a 10% damage before I start having some swelling so I can, hold on to what I've got. Surely if my blood pressure is pressure cleaning my kidneys or there's some underlying condition, you can give me a little heads up, give me some swelling in your feet so I know to go to the doctor and start having testing done. No, by the time you have significant edema or anything like that, or even like noticeable edema, yeah, too late. You're like 75, 90%. That's just a cruel trick. That's just flat out mean. That's like waiting until the floors in your living room are moist to find out your basement is flooded to the ceiling. It's too late. Damage is done. You just burn the house down, start all over, because that's crazy. Same kind of thing here. So if you're taking, 10 milligrams of Lasix every day, there's still a kidney problem. I'm not going to doubt that there's not a kidney problem. And if, it's for blood pressure and that sort of thing, that's kind of like, I use the same example as if your basement is flooding, you're like, well, we need to go buy more towels to mop up all of this fluid. I'm like, how about, honey, to my husband, instead of buying more towels, sweetie, how about we find out where the leak is coming from and repair it? How about we fix the problem instead of continuing to hide the problem? So telling your kidneys just to work a little bit better, that means that they're already not working well enough. So what is causing the damage to the kidneys? Is it uncontrolled hypertension, or, is there some sort of cancer? Is there something going on that's causing this damage, instead of just hiding that and being like, oh, well, we'll give the kidneys a good swift kick in the crotch once a day with the 20 milligram Lasix, instead of finding out why they're not working correctly. So I'm not buying any more towels. I'm going to find out what the problem is. So when someone's on 20 or 40 of 60 of Lasix every day, you have kidney disease. You can pretend it's CHF all you want, but the C, yeah, that's starting with congestion. Where's the congestion coming from? Lack of excretion. What excretes? Your freaking kidneys. You have a kidney disease. You have a kidney problem. You have kidney failure. You have some sort of chronic renal disease. That's all there is to it. And we'll get into CHF deeper down the line, but that's what's happening, right? So when we talk about CHF medications, it's either, we're going to try to help the heart, which is your pump, the vessels, which are your hoses, or the amount of fluid that's in there, right? I always talk about watering your lawn. So if you're standing at the hose and you want to water your tulips way on the edge of the fence line over there and you can't reach it, you're going to put your thumb over the hose to get more pressure, right? So you could turn the pump up farther. You can constrict that hose, or you can add more fluid to it, right? Which would be, in this case, kind of, turning that pump up, because that's how you water plants. But all of those three basic things, it's the same thing. It's your C, right? That's your cardiac, your heart is your hoses, and your F is your fluid. So is what CHF is. That's all there is to it. The heart is not pumping correctly, which may have inhibited some blood flow or perfusion to your kidneys and other, organs as well. But very few people come in with liver failure with CHF. That's not a thing. Or, they managed to keep their toes and yet their kidneys were damaged, right? Because chances are we pressure clean those kidneys long enough to where they're no longer working correctly, and we have excess fluid, which created more pressure on the heart, which made the vessels constrict because your cardiac output has diminished, which constrict those vessels, which pressure clean your kidneys, which causes more damage, which causes more fluid to be retained, which makes the heart push harder against the pressure that the vessels have created because of the constrict. Okay, you see what's going on here? See how that works? Right. That's basically my pet peeve. People don't understand congestive heart failure, and it's so simple to me. I even had a friend of mine say, like, well, my mom quit her digoxin and her feet blew up like a balloon. So when she went to the hospital with her CHF exacerbation, did they give her a quick IV dose of Dig, or did they give her Lasix because her kidneys are failing? My other girlfriend, as she's salting her sausage and eggs breakfast that morning after having clocked in at work, we're sitting there and she's like, well, I forgot to take my Lasix this week and my feet blew up. And I said, well, that's because you have kidney disease. And she straight up to my face said, no, my doctor says my kidney's fine. BU creatinine is fine. It's my heart. It's just my heart. Your heart doesn't retain fluid. It doesn't have anything to do with that. Okay, so I know what you're thinking. You're thinking like, well, the heart isn't pumping enough, so it's not creating that distal onconic pressure, kind of that, rush to the capillaries to, so Starling's law can kind of, kick in and cause that rubber band effect and that kind of draw back and to pull that capillary. Well, guess what? Lasix doesn't do that either. That's not where Lasix works. So you have kidney failure. You can deny it if you want to, and, forever. But when you're drowning in your own fluids because you keep eating Kentucky Fried Chicken and you keep salting your Egg McMuffin in front of me, the blood pressure police, I'm going to tell you what's actually happening. You don't have to like it, but it won't make it less true. Sorry. Okay, so that's it. I don't really have a pet peeve, but I will tell you a patient this week. Where did I put my little, I remember it so I don't have to have it, but he did tell me that he had a hiatal hernia. A ladle. Like how you scoop up punch from a bowl. Hiatal hernia. Precious. It's just so cute. Wait till we get to those. I've got pages and pages. I could end every one with one of those. That's not even a pet peeve. That's just adorable. I could end every single one with one of those. I don't even have to have pet peeves. I can end it with those and it would still be precious. All right, so that's it. The same as always, face your fears, forget your failures, follow your faith. Hugs and kisses for the 6 of you still watching this. Miss you, love you. And let me know what you think, or if you want me to touch on a subject. And if I know about it, I'll help you. If I don't know, I got nothing. I'll tell you, I don't know. If I can research a little bit, ask some of my doctor friends, and then maybe explain it in a better way to you, I will. If I know nothing about it, I got nothing. Listen, what I do know, I know like I know like I know, and what I don't know, I'm not gonna pretend I know. Listen, horses, you wanna talk horses? I got you. You wanna talk men? Because they're really simple, it's really just about one thing with them. We can talk men. Nursing, I can do, but if I don't know it, I'm not gonna pretend to know it. Don't ask me about a, respirator or machines in ICU that keep you alive. I got nothing. But this basic stuff I can help you with. So if you got questions, hit me up in the comments, or you can even direct message me, whatever you want, and I'll help you any way I can. So okay, talk to you soon. It's not gonna do it. Just, you know what, you piece of, I feel like Phoebe and her smoke detector that just, is it a double click? Nope. I just, okay, at this point, it's just friggin' stupid.